Welcome to this video on the internal aspects of the pelvic organs. In other videos we have discussed the role of the visual peritoneum in the movement of the gut. The peritoneum not only covers the abdominal organs, but also the superior aspects of the pelvic organs. The abdominal cavity is continuous with the pelvic cavity without any sharp morphological border. Many medical students experience difficulties in learning the anatomy of the pelvic organs. This is due to the complex 3D relationships of the organs and their supporting and supplying structures within the small and narrow pelvis. Another frequently mentioned reason is that many commonly used descriptions and definitions are confusing or sometimes even contradictory. To interpret correctly cross-sectional MRI or CT images of patients at any level for pathology screening or for surgical planning, it is necessary to fully understand the pelvic 3D anatomy. Let's start with a right view on the abdominal pelvic cavity with the sigmoid and rectum. The pelvic floor supports the rectum and contains its sphincter complex. Anteriorly in the pelvis is the location of the bladder. The vagina is firmly attached to the posterior rectum and the anterior bladder. These strong connections are essential to prevent prolapses. The uterus is located superior to the vagina, in a so-called anteversion position. An anteverted uterus angles anteriorly with regard to the vagina. Thereby it lies on the bladder. Note that the uterus is curved, as the fundus points anteriorly relative to the cervix of the uterus. This is called anteflexion of the uterus. Anteversion and anteflexion are the most common positions. However, they can also angle or bend posteriorly, which is called retroversion and retroflexion. The visual peritoneum covers the superior aspects of the pelvic organs. As the peritoneum folds over the rectum, the uterus and the bladder, it generates a feature with hills and valleys. The uterus, which is two laterally extending fallopian tubes, over which the peritoneum is folded, divides the pelvic cavity in an anterior part above the bladder and the posterior part. The pelvic cavity posterior to the uterus is the deepest part of the abdominal cavity. A more mid-sagittal section of the body can illustrate it better. This deepest part is anatomically called the pouch of Douglas, after the Scottish obstetrician and anatomist James Douglas in the beginning of the 18th century. In case of, for instance, a bacterial peritonitis, acidic fluid collects in Douglas pouch. There it irritates the peritoneum and pain can be felt in the dorsal wall of the vagina. We have seen that the shape of most abdominal organs that are covered with visual peritoneum regularly changes. In the pelvis, the volume of both the uterus and the bladder can increase dramatically. In case of pregnancy, the uterus enlarges superiorly within the abdominal cavity. In general, when a bladder is enlarged by the storage of urine during the day, the bladder enlarges in front of the peritoneum. And this has two consequences. In case of a caesarean delivery or an hysterectomy, both the abdominal wall and the peritoneal cavity have to be open to reach the uterus. In case of a distension of the bladder, which can occur with long-standing urine retention, the bladder stretches between the abdominal wall and the peritoneum. The bladder can be emptied by placement of a catheter through the abdominal wall into the bladder. I want to summarize the folding of the peritoneum from a more surgical point of view. First, we have to orientate in the superior view with the peritoneal cavity. This is the anterior side with the pubic bone, the posterior side with the sacrum, and here are the left and the right pelvic side walls. Light grey is the covering peritoneum. At the right side, the peritoneum has been removed, which gives us a view on the underlying structures. The peritoneum is covering in the midline, the bladder, the uterus and the rectum. Note the deepest part of the peritoneal cavity in between the rectum and the uterus, the pouch of Douglas. At the lateral side, the peritoneum covers the ureter, the ovarium and the fallopian tubes, and, of course, the pelvic floor and the supplying vessels and nerves. If you tilt the uterus together with the fallopian tubes upwardly, the peritoneum hangs down from the fallopian tubes and divides the pelvic cavity into an anterior and a posterior half. If you were able to translate the structures from the sagittal point of view into an abdominal view easily, you are blessed with an excellent 3D imagination. If you experience difficulties in combining the 2 points of view, please compare the figures again or exercise with the 3D visible human viewer of the pelvis.